Hello all, and thank you for joining us this week's Rise and Thrive with EHE Health. It is an interactive series where each week we talk about all health together. My name is Jessie Leon Soto. I am an EHE Clinic Director. I've been with the EHE family for over 20 years, and it's been an honor and privilege for the last 10 years to be a leader of great clinicians where they use evidence-based approach and screening tools to prevent disease. Today, it is my absolute honor to be joined by Dr. Cara Pensabene. She's our very own Vice President, Medical Director. Dr. Pensabene joined EHE Health in 2015. And Dr. Pensabene, if you can tell us a little bit more about you.
Well, thank you, Jessie. So yes, as Jessie mentioned, I have been with EHE Health for the past 5 years. When I first joined, I was serving as a board-certified internal medicine physician, delivering our preventive care exams right along with Jessie under her direction at our Stanford clinic. Throughout the years, I've had the privilege to now lead our medical staff as the Vice President Medical Director, and am also board certified in lifestyle medicine. It is my honor to be here today, and happy October 1st, Jessie.
Yes, happy October 1st indeed. And I guess what better topic to talk about today, breast cancer awareness. Dr. Pensabene, I thought we might start off the discussion talking about some myths that we collected from our patients, and perhaps our listeners may be thinking the same. Can we begin by the first one? And the first myth that we hear so often is, I am very young, why do I need a mammogram?
You know, breast cancer is such an important topic, and our goal at raising awareness is such an important topic, and such a great way to kick this off by talking about the common things that we hear from our patients every single day. And it's our job to really debunk those myths. And this one, you know, I am too young to get breast cancer. Although it is true that younger women generally do not consider themselves to be at risk for breast cancer, you know, it can strike at any age. And a significant proportion, 5% of breast cancer cases, occur in women younger than 40 years old. And the facts are that all women should be aware of their personal risk factors for breast cancer.
Yep, thank you, Dr. Pensabene. There's another popular myth that we have, and it's, I don't have any family history. I'm not at risk. Why should I get a mammogram?
You know, that is another common one we hear, that only women with a family history are at risk or need mammograms. And again, the facts show that more than 75% of women with breast cancer have no family history of the disease. And really only 5 to 10% of breast cancer diagnoses are due to a known genetic mutation. So it's true that if you have relatives who have had breast cancer, you may worry that you're next. And family history, you know, we're gonna talk about this a little bit later too, but that usually means having 2 or more first-degree relatives, like a mother, sister, or daughter, or second-degree relatives, aunt, niece, or grandmother. So 2 or more close family members who had breast cancer. And for those people, the risk does increase with family history. So this is true that people with a family history do have an increased risk of developing breast cancer. Most of these women actually don't get breast cancer. It's the 75% of us that don't have that genetic mutation.
Thank you, Dr. Pensabene. Thank you. That's very important information. In fact, there's another one that we also get very often, but very important to discuss. Men do not get breast cancer. Can you talk to us about that one?
You know, this was something that I may have missed the day we covered this in medical school too, because it really wasn't until I came to practice at EHE and really understood the value of prevention that I learned too, that although men don't have as much breast tissue or the same type of breast that women do, they do have a small amount. And, we think of this type of male breast tissue as similar to a prepubescent girl. It's small, it's there, but it can grow into breast cancer. And less than 1% of breast cancer cases occur in men, but tell that to the 1 out of 1,000 men who do get diagnosed with breast cancer. It definitely can happen in men, although women are at higher risk.
And Dr. Pensabene, I got to tell you, I know we're both passionate about this topic. And when I hear the strong testimonials that our patients deliver, I mean, just a few years ago, we had a 45-year-old male patient that came through us, and through a physical exam, the doctor did find a lump and asked the patient, and the patient clearly said, "Oh, I thought it was going to go away," and together with that patient and physician decision-making tools, they decided, let's go on ahead and get that mammogram done for you. And we did. And 3 years later, every year he's monitoring that lump with the breast cancer specialist. So, and again, in the media, in the public platform, we also have Beyonce's dad. Mr. Knowles, can you talk to us a little bit about that case?
Absolutely. And that patient's testimonial, Jessie, that is so compelling. And it's really the message of prevention and listening to your body, and understanding that although the risk might not be high, there is risk, and that men can get breast cancer. And Matthew Knowles is a great example. He's one of many famous celebrities that have been affected by breast cancer and really used their platform and their celebrity status to raise awareness. And, most of us know Matthew Knowles as Beyonce's father. He's a music executive, and he is a 68-year-old man. And this was just last year that he announced that he was battling stage 1A breast cancer during an interview with Good Morning America with Michael Strahan. And he tells his story about how he had some blood on his sheets. And he really didn't think that could have been anything related to a breast cancer. And he noticed it on his white t-shirt. And really, after encouragement, he went and got tested and checked out and was diagnosed with stage 1A breast cancer and found to have one of that genetic mutations that we talked about earlier, the BRCA2 positive mutation. And really, in his account, he's so compelling. He shared his story about coming to terms with his diagnosis and really the importance on the stigmas and breaking those stigmas attached to male breast cancer, and how he hopes to be an inspiration that more men will come and speak out about it.
And as I said, these are the celebrities that come out on the platform to increase breast cancer awareness. We also have another strong voice in the public community, Angelina Jolie. She's another one.
And another really great example of a celebrity that has come out and spoken about her journey and her challenges. And it reminds us that each patient, each individual's case is unique. And in Angelina's case, she actually lost her mother at 56 years old after a 7-year battle with breast cancer. And throughout this, Angelina got tested herself, and similar to Mr. Knowles, was found to have a genetic mutation, Jessie, but hers was the BRCA1 mutation. Wow. And as a result of talking to her doctor and understanding her own individual risk of developing the disease, she found out that she was at an 87% risk of developing breast cancer. And with that risk, she chose to undergo a surgical procedure to have a double mastectomy to really remove her breast tissue and significantly, dramatically reduce the risk of developing a genetic breast cancer in her lifetime. And, as a reminder, only about 5 to 10% of diagnosed breast cancers are like Angelina's mother and are due to these genetic mutations. So prophylactic surgeries are not necessary for most of us. But in her case, with that 87% risk, she really, really understood that she didn't want to lose her children to cancer like she lost that her children didn't want to lose their mother to breast cancer like she lost her mother. And in women who have this BRCA1 genetic mutation, the risk is real. It's a 60 to 90% risk of developing breast cancer, Jessie. So again, another huge proponent of awareness and screening and understanding your risk and really taking action.
And Dr. Pensabene, thank you so much for going right into the next topic that I want to discuss. Let's discuss about risk factors. Can you talk to us a little bit? I've collected some concerns of our patients, but if you can start us off in some risk factors.
Yep, and we've mentioned a few of them so far, Jessie, in different ways, you know, and risk factors are some risk factors are ones that you can control, ones that might be environmental. And there are some risk factors that you can't control, and those are ones that are more biologic. And gender, you know, being a woman is by far the main risk factor for breast cancer. You know, we spoke about how men can develop breast cancer, but it's 100 more times more common in women. Another one is aging. You know, the risk of breast cancer increases as you get older. And the facts are that 1 out of 8 women will be diagnosed with breast cancer in their lifetime. And another one that we touched on really with Angelina and with Matthew Knowles, and we spoke about the hereditary risk, and that's the BRCA1, the BRCA2, the genetic mutations. Again, 5 to 10% of these are hereditary, but there is also, you know, women or patients who have the inherited breast cancer risk. They also have increased risk of other cancers, and women with these genetic mutations are also at increased risk of developing ovarian cancer. And, you know, there are certain ethnicities, certain hereditary lines that these mutations are more common in, but the facts are that they can occur in any racial or ethnic group.
Okay. And Dr. Pensabene, how about family history? Can you talk a little bit about family history?
Yep. Another one we can't control. Family history does increase your risk of breast cancer. And we did mention this before, but having 1 first-degree relative, a mother, sister, or a daughter with breast cancer, it essentially doubles a woman's risk. Wow. Having 2 first-degree relatives with breast cancer increases your risk by about 3-fold. And although the exact risk is not known, you know, women with a family history of breast cancer in a father or a brother also have an increased risk of breast cancer. So in Mr. Knowles' case, you know, Beyonce and Solange also needed to get screened and understand their risk, although we don't know the exact number. And altogether, less than 15% of women with breast cancer have a family member with the disease. So it's really important to note that the large majority of us do not have a family history of breast cancer when we get diagnosed. It does increase your risk, but it's not the majority.
And I know that you touched a little bit on ethnicity, but how about our African American women?
You know, this is one that we at EHE are especially passionate about, and something that more research is definitely needed to be done. But African American women are more likely to die from breast cancer. We don't fully understand why, and that is not acceptable. We do know part of this is because invasive breast cancer risk continues to increase by 0.5% per year in African American women. But again, more research needs to be done into understanding why. On the other hand, you know, other ethnicities and races, Asian, Hispanic, and Native American women, for example, they actually have a lower risk of developing and dying from breast cancer.
The numbers are just astonishing. One that I personally am concerned about is dense tissue.
This is very, very common, especially in premenopausal women. Dense breast tissue is expected in a lot of cases in premenopausal women, and it's not really until we go through menopause that the breast tissue composition really changes to become a little bit more fatty. So dense breast tissue is common. It is also a common risk factor, as you pointed out, for breast cancer. So women with denser breast tissue, as seen on a mammogram, they have that higher risk. And And it's harder for doctors to identify cancers or microcalcifications on mammograms because the tissue is so dense. So it's an increased risk, but it's also a concern that cancers can be missed in women with dense breast tissue.
And Dr. Pensabene, thank you for that one. We can probably go on with more, but there is one that a lot of my friends share the concern, and it's the prescription, the therapy, the birth control pills. Can you talk a little bit more about that?
You know, prescription hormonal therapy, birth control comes in many forms. Many women at different points in their life take birth control or contraception for different reasons. You know, more and more of us are delaying having a family to focus on career. In some cases, you know, it's medically necessary to take birth control to control some other hormonal disorders. So really, a lot of us do choose to take prescription hormonal therapy at some point in our lives, and we do need to understand this risk. You know, it is a slightly higher risk of developing breast cancer while you're taking the medication and for some years after. But the really good news is that it does go down when you stop. So for example, Jessie, if you're taking the birth control pill, you know, your risk of breast cancer will go up while you're on the pill, but it will return back down to normal within 10 years of stopping the pill. Or for those of us that get the shot, the Depo-Provera shot or oral contraception shot, you know, it's the same thing. You'll have an increased risk while you have the medication in your body and for 5 years after. And the message is really, when you're thinking about using these drugs, that women should discuss all of the risks and benefits. It's the same as any medication, and all of your other risk factors for breast cancer with your healthcare provider.
Thank you, Dr. Pensabene. And I guess now that we touched on the myths and we went over risk factors, how can we get screened? Can you talk a little bit more about that?
Yeah, and I think it might be really important here, you know, before we talk about breast cancer screening, to just let's talk about what is screening. It's something that you and I, you know, understand very much. It's what we at EHE Health, as the experts in prevention, do every day. And screening is really testing. It's a way to look for cancer or diagnose a different disease at an early point before your symptoms would develop. And benefits of screening sound obvious. You know, they help us find things before they spread while they're still treatable. And screening for breast cancer, as we know, it's so important because if breast cancer is found during a screening procedure, the facts show it is much more likely to be small and contained. And in breast cancer, like most cancers, you know, the size and the spread really determine a woman's prognosis and course. But that wasn't your question. You were asking about breast cancer screening, or what were you asking me, Jessie?
Well, how can we get screened for breast cancer?
You know, breast cancer screening does come in several different forms, but the one that most of us will get in our lifetime, the one that is the gold standard breast cancer screening and that we want to touch on today, is mammograms. Mammograms are really a fancy word for x-rays of the breast. And during a mammogram, you know, the breast tissue is squeezed or compressed flat between two plates. And that helps get that x-ray image and look for what we were talking about before, microcalcifications, the earliest signs of breast cancer. They're seen on an x-ray. They look like tiny little popcorn kernels. You know, and mammograms have so many benefits. They're quick, they're safe, they're low dose, they're effective, and they reduce breast cancer mortality by 15 to 20%.
Wow.
And if you start getting screened or start having your screening discussions at age 40, you know, mammograms avoid 1 breast cancer death per 1,000 women screened.
And Dr. Pensabene, as you're saying this and talking about this, once again, there's another testimonial that I remember, and this is of that international lady, the 42-year-old woman, who came to us for the first time. and had the annual exam. She was 42. And once again, she declined the mammogram because she was 42. And our doctor, again, the patient, physician decision-making tools, we convinced her to get the mammogram done. And the reason she didn't get that done is because in her country, they don't start until the age of 50. So we had to go for her mammogram. And unfortunately, it did come back positive. But 3 years later, she is she's under the great care of a breast cancer specialist. And once again, if you can talk to us a little bit about the United States guidelines.
Yeah, and we do hear this all too often, and we do have to recognize that screening and guidelines do vary, by country, and they vary even by medical society here in the United States. And at EHE Health, we really follow the guidelines that are outlined by the United States Preventive Services Task Force. And then we supplement those guidelines with the other experts in the field, the American College of Radiology, the American College of Obstetrics and Gynecology, for example. And the guidelines in breast cancer screening are all very consistent here. Start those conversations at age 40 if you are of average risk. You should understand your individual risk, and women between 40 and 49 really have that conversation, understand your risk. Once you do that, you schedule your mammogram every 1 to 2 years. As a doctor, Jessie, as a clinic director, we know that mammograms and early detection of breast cancer saves thousands of lives each year, and that so many more could be saved if even more women and their healthcare providers focused on prevention and took advantage of these tests.
And Dr. Pensabene, what a better way to finish up our topic discussion in going over how can we reduce these risk factors?
Absolutely. So we just talked about following the guidelines for early detection of breast cancer. We know it improves the chances of breast cancer being diagnosed early and successfully. We start having those conversations at 40 years old if we're at average risk. We start having those conversations sooner if we have any of the risk factors we talked about. But risk prevention, risk reduction starts way earlier than 40. It starts now. It starts today. And if this pandemic has taught us anything, we do not know what tomorrow looks like. Exactly. And Dr. Levy, our CEO, has been quoted to say that COVID compresses time, and it is so true in prevention. Many people avoided getting their mammograms due to the pandemic and might be behind on that early detection. So message today is get your mammogram and focus on how you can reduce your own risk. And you have to really focus, like anything in life, right, on the lifestyle factors, the ones that you can control. Get to and stay at and maintain a healthy weight the best you can. And we know, our pillars of how you eat, how you think, how you move totally apply here, Jessie. You want to increase your physical activity. Make sure you're being active, you're avoiding sedentary behavior, and you're meeting those guidelines at the exercise needs for your body. Staying at a healthy weight. Reducing or avoiding alcohol. We didn't really talk about that one earlier, but that is absolutely a modifiable risk factor. In women, really, we should reduce our risk of breast cancer and many other diseases that you wouldn't think just by sticking to 1 drink a day. So really reducing your alcohol intake and focusing on these lifestyle behaviors. I want to just also say, do what we're doing today, right? Spread awareness. Yes. Get screened. 1 in 8 of us, we said, will be affected by breast cancer in a lifetime. You and I know mammograms are lifesavers. So schedule your preventive exam. Schedule it with EHE Health. If you have our benefit, as Jessie said, it comes along with the annual mammography, which is that you can do every 1 to 2 years. Yes. All of our EHE preventive specialists are trained on having those conversations, assessing the individual's breast cancer risk. If you don't have the EHE benefit, still schedule your preventive exams, get your mammograms, talk to your doctors. The time is now.
Well, Dr. Pensabene, I have to tell you, thank you very, very much for educating us on the breast cancer awareness, on the myths, the risk factors, how we can screen, and how we can reduce these risk factors. It has been my absolute pleasure and honor to share this space with you. And to our listeners, please stay tuned next week for another topic on our Rise and Thrive with EHE Health. Thank you, everyone. Bye.
Thank you.